So the functional medicine approach, this is the systems that we're talking about. When you have a dominance of Th1, you're going to have a hyperactive autoimmune system here. This guy is down, this guy is up, and you're developing hyperactivity. Th2 is on the outside of the cell. It's the immune system that works on the outside of each cell. It's looking at the outside of the cell. And so this is when we have a dominant disease that T1 is working inside the cell to prevent us from getting cancer and stuff, but Th2 on the outside is becoming weak. And so we start developing, getting hyperreactivity. When you have a low-grade Th1 or Th2 dominance, then your Th1 gets very weak and you lend towards cancers and things like that. Ulcerative colitis. Some people have both going on. Health considerations for autoimmune disease. Stress, that's me. Leaky gut, this is what happens to your gut with stress. Gluten intolerance, that's me. I don't have celiacs right now. Estrogen fluctuation, that's me. Insulin resistance, I don't have that, thank God. Vitamin D, that's not me. Some inflammation, I did have infection, heavy metal toxicity. I'm going to tell you my story. I've been remodeling my house for about 5 years, and I tore out a bunch of old insulation, and I had a hazmat suit on, okay? And I have a lot of these things going on. And so I was working my tail off. I was working 7 days a week. I'm working 12-hour days. And when I'm not in the clinic, I'm upstairs tearing out insulation and walls. And so I got this area out, and I'm putting central air in upstairs. And I tore all this insulation out, and then I spray foamed insulation in. Well, within 2 days, my face started peeling and peeling and peeling and peeling. It must have peeled 200 times. I thought, oh, this is just a chemical burn, right? No problem. It didn't go away. It kept peeling and peeling and peeling, and no matter what I ate or what I did, my skin kept flaring up and causing this immune reaction. That was a year ago. I still have it. Because my immune system, it was like the trigger for me that sent my system into full-blown skin disorder. Now, I had skin cancer back about 5 years ago, and so I have skin issues to begin with. And so then I was playing around with some toxic chemicals, and it just set my immune system off. And I go into this reaction because now I have several of these things going on. And then I added an environmental toxin to my system that I haven't been able to completely. I get in the sauna and my skin turns red and it's flared up like crazy for days because the toxins are coming out. And this was a year ago. So last spring, the skin had kind of cleared up. I did my magic, right? So I thought, I had one little section, I'm going to do this. I'm going to put stuff over my face. I'm not going to let it touch my face again. Did it again like a dummy, right? And now it's like back again and I can't get rid of it. So these things trigger. When you have the environmental pollutants and toxins and you have these other things, it takes one single moment. I had a young girl that has autoimmune disease. She was 21 years old. No symptoms. She went off to college. She got involved with a guy. He had mono. She got mono from him. And within 2 weeks, she was bedridden. She had RA symptoms so severe, she couldn't get out of bed. And I have not been able to help her. We can get it to go down, but she ended up going on methotrexate or whatever. It triggered. Like she had this going on for a long, long time, and she got mono, and it threw her over the edge into autoimmune. She couldn't even walk half the time. So these things can be going on underlying, and you get one little single trigger, and boom, you're like in the end stages of this process. Because this has been going on for so long. So without a doubt, the stress is the biggest factor, and I'm going to tell you it brews. It brews lots of diseases. The adrenal dysfunction in response to stress, the cortisol, which elevates in stress, tends to thin the lining of the gut. It weakens the immune system, and it causes the thinning of our barriers between the outside world and the inside world. So here's a patient, she's going through a divorce, and here's her cortisol down here in the yellow that I have circled. It should be in the green, and she was heading into a divorce. Now I will say to you that this situation is abnormal and will cause autoimmune disease. If you stay in prolonged levels of stress for a long period of time, this is a lab that I do in my office, and I check cortisol because cortisol causes your gut lining to thin, which causes all this stuff, this conventional diet that you're eating, into your system. And so we look at cortisol. This person we've treated this, and it's come down, and she's doing quite well. Abnormal hormonal fluctuation, estrogen dominant. Well, if you're a female, which most of us except for Dave here, have estrogen fluctuation or dominance. We have xenoestrogens. Remember the plastics I was telling you about, the toxic chemicals, the Roundup, those all have xenoestrogens in. You also have those in your body too, Dave. The estrogen dominant causes the GI tract to dysfunction, and so that's also leading to autoimmune disorder. So it's very important to have your hormones checked as well and get that. So people will come in and say, I have a diagnosis of XYZ, and I'll say, well, let's fill out the 21 pages of paperwork and we'll find out what your underlying causative factor is. Is it hormonal? Is it adrenal, thyroid? Is it GI? Is it whatever? You have to get to the underlying causative factor. Gluten sensitivities, as I showed you in a couple slides before, thyroid disease or Hashimoto's, Graves and Hashimoto's, you have a 1,300% increase in celiac disease you're going to end up with Hashimoto's if you have celiacs and vice versa. Gluten and thyroid are not good. And here's why. It causes, gluten causes the zonulin to be destroyed, and it causes that leaking gut, and it causes the stuff from your gut out into your immune system, and then the immune system starts going haywire. And as we said, it attacks our immune system and causes inflammation. Usually autoimmune of the thyroid starts out as hyperthyroidism, and then it follows up by hypothyroid. Most people don't know. They think they have a lot of energy, and that exercise program they're on is really good, and they're feeling really good, and they're up, and they only need 3 hours of sleep. That's hyperthyroid. And then eventually you end up in hypothyroid, and that's when they drag their butt in to see me because they can't function anymore. Most patients that are taking thyroid replacement are on the spectrum of autoimmune in this part of the country. Thyroid problems can cause a whole host of things. Your thyroid is the master gland of the immune system, so it's very important to get that regulated. Here's a sign of thyroid Hashimoto's. You're going to have heart palpitations, trembling, pulse issues, nervousness, emotional stress, insomnia, night sweats, difficulty gaining weight. Here's a patient of mine that has, she was born in Ukraine, and she was near the Chernobyl thing where they had the bomb, and she got radiated, the thyroid got radiated with a whole lot of radioactive chemicals. And so when she came in 2016, her thyroid antibody was 264, and her immunoglobulin was 227. Okay, she was in full bloom. She had eyes poking out of her eye. She refused to go on medication. She refused to go down the road of them radiating it and completely killing it. And in about a year and a half, we took her thyroid antibodies, her TPO, from 264 to 42. And we took her thyroid stimulating immunoglobulin from 227 down to 103. Now, it's not gone, but she's symptom-free now. And her thyroid is working normally. Her T4, her T3, she's functioning normally now. So she can live with this amount, but it starts creeping up and she starts going off the diet and she starts getting messy. This starts elevating back up. It's not going to go away. I can't completely make it go away now. But you can see with a diet change and supplementation, we took this thing way, way down, and she's in the asymptomatic phase, and the disease isn't progressing. Vitamin D is extremely important. If you have not had it tested, you better get it tested because it regulates between Th1 and Th2. Vitamin D helps mediate AI, thyroid conditions. It's very helpful in inflammation, lots of different things. I'm going to just briefly talk about AI disease and infectious disease. I could have put 50 slides in on this. I don't have time to talk about it. This is where I was cutting corners at this point because I'm only in slide 88 here. But infectious disease is definitely involved. You get mycoplasma, Epstein-Barr. There's a lot of things that cause gut dysregulation and infection in autoimmune and in autoimmune thyroid conditions. Mycoplasma is one of those that we look at for that. Iodine deficiencies are rampant in autoimmune, and iodine is one of the things that it's in your thyroid gland. The blood passes through your thyroid every 11 minutes. And iodine helps kill the bad guys as it goes through the thyroid. And when you have low iodine, when you have autoimmune, and most of us in this room have low iodine because we live in the Midwest. We don't get any iodine. It's not in our soil. We don't eat seafood and fish, and so our iodine levels tend to be low. Now, if you think you have low iodine, you don't want to go out and just start taking iodine if you have an autoimmune disease, because unbound, protein-bound iodine will cause the condition to get worse. You have to get a certain kind of iodine that's protein bound that won't attack your thyroid gland or any other tissue. Now we're going to go back to that artificial sweeteners. These things mimic the thyroid gland. They make it very dangerous. They cause the thyroid to dysfunction. And so many of these conditions, when you have thyroid condition, you have to get off the artificial sweeteners. Sucrose is chlorine. Chlorine kills the thyroid. It's partly why I had a problem. I was a lifeguard and taught swimming for many, many, many years through college. And by the time I got out of the pool, my thyroid was half dead because I was in chlorine for 15 years. And so it leads to iodine deficiency. If you're a swimmer, if you have somebody that swims a lot, they really need to be taking iodine because iodine blocks chlorine from damaging the thyroid gland. Again, artificial sweeteners are in these things. You've got to stay away from them. Chewing gum like Trident and all of these things, soda pops, diet this, diet that, it's all in that kind of stuff. Cereals. Heavy metals cause immune dysregulation, and they're very toxic. They're all over. They cause inflammation. They're very difficult to get rid of as well. Mercury is found in fish. Lead is in, they used to have put it in the gas, they don't anymore. Arsenic is in lots of different things. Testing for heavy metal, it's important if you have autoimmune disease to be tested for heavy metals. It's a fairly inexpensive test, it's a hair test. This is what it looks like. Here's the heavy metals up here, the most common ones. These are the minerals that she laid them out, so this is a test that we do in our office for cancer patients and autoimmune patients. Here's the other kind of testing that we do for autoimmune function, and these lists are long and overwhelming. And I wouldn't expect you to go, oh my gosh, what the heck. These things are options that we look at when you come in and fill 21 pages of paperwork out to determine what we need to look at for you. And we peel it back like an onion. And we start with the most obvious stuff, and sometimes it fixes it and sometimes it doesn't. And then we might move on to the next thing. And we keep going until we get the system re-regulated. You can't stop and go, oh, that didn't work. I fixed my gut, and so that I'm done now. Well, you have to look at the whole system. And if you had to run all these tests, you might as well just bring me your bank account and your savings account because, you know, this is thousands of dollars worth of testing. We don't do all of this testing. These are testings that are optional testings that we look at based on what your intake paperwork is. This is a test that we look at that it's people that are really sick. It's a multi-autoimmune reactivity screen. It's by Cyrex. This is the guy that lent me his slides. These test multiple tissues to see if you've got more than one thing going on. These are people that are in the advanced disease process. This is allergy testing. This is my son's testing. I blanked it out because I told him I'd do that. But he has, you can see cow's milk is quite severe, and he likes to sneak food when he's at school. And I can tell that he's been drinking milk because his levels are out of range. We don't drink milk. He's never had a glass of milk in my house ever in 8.5 years. I can tell he's drinking milk because they're in the outer range and they're severe. And chocolate milk, of all things, that has sugar in it. So I'm like, yeah. He's got eggs and raw eggs and soy, very severe. He's Asian, and he had a lot of soy in his previous life before my house. This is his gluten. I've had him off of gluten for some time, but he has a severe gliadin problem, which is causing his brain dysregulation. This is all the different forms in parts of the gluten that we look at. These are all different forms that you can be allergic to. Transgluminase is the stuff that affects the brain and the brain dysfunction. This is additional testing that we look at. This is some of the basic testing that we do in our office. We do glucose regulation, hormone testing, leaky gut. These are some of the things that we start with in our office. This is a basic panel that we use in our office. This is my son's panel. He has very high ferritin level. And at the time, he was only maybe 10 when I did this. Ferritin is an inflammatory marker. It's an iron marker and it's very high, but it's high in the inflammation. It was 75, normal is 57. So he's very inflamed. He is in autoimmune, and he is in brain. He has ADHD, something terrible, and I can tell instantly when he's eating something he's not supposed to, because he starts slurring. Here's a gastrointestinal panel. We do a lot of these. We usually start in the gut. When I start assessing a patient, I'm looking for leaky gut. I don't very often do a leaky gut test because you can tell by patients' symptoms that they're leaking, and we just get to the root of the problem, what's going on in the gut and what's wrong with it and how to fix it. Okay, this was a panel I showed you earlier. This is a normal, this is the hormone panel and the adrenal panel. This is important to look for stress response, for hormone reaction response. And so this is definitely something that we look at, particularly in females that are developing autoimmune. It's usually always hormone related. This is again the heavy metal lab that we do. So the treatment for autoimmune problems is a complex process. You have to look at, people complain about the paperwork I make you fill out, but it really directs me towards your biochemistry and understanding where we need to go with the testing. Because we're not spending $5,000 on lab testing. We're going to spend, a bit of money to get the foundation and then go from there. So it can get very complicated. That's why medically they're not treating this, because there are no really direct pathways. It's a functional medicine approach that we're looking at. So how are we treating the immune system? If you want to go away today and do anything, I've put a couple slides in. Change your diet. Get the gluten out. If you think you have infections, get the sugar out. Reduce your inflammation, reduce inflammatory markers, stop eating corn-fed beef, stuff that's high in arachidonic acid. You've got to change your diet. You've got to get the toxins out of your diet. Repair the gut. You have to re-regulate the immune system, balance out. Vitamin D deficiency is so important. Try to remove the toxins from your environment. Stop using toxic chemicals to clean your house. Stop using laundry detergent that's toxic that you're wearing on your clothes every day and you're smelling those fumes. That chemical that the dryer sheets and the laundry detergents that have the really heavy smell, and they even advertise this on TV. It will stay fresh in your drawer for 600 years. I think it's like 2 weeks or something, I don't know. But those are petrochemicals. Those chemical scents are not natural. They're made from petrochemicals and they're extremely toxic. If you have autoimmune disease, you have to get that stuff out of your house. Period. Out. There's a whole lot of stuff that you can do just to remove the toxins out of your system. If you have been exposed to a lot of toxins in your job, or, you know, you've got to go through a detox. Saunas are some of the best way to do that. You got to get your blood sugar under control, because blood sugar is going to cause inflammation. It's going to cause infections to get worse. This is what you've got to do to get your blood sugar. Make sure you eat protein for breakfast. End of sentence. Start your breakfast with protein. Do not feed your kids Lucky Charms before they go to school. That is a bad idea. It's inflammatory. It's full of food colorings. It's not good. Eat small meals every couple hours that have protein in them. Find your tolerance to carbohydrates. Never eat high sugary foods without fiber, fat, and protein. You know, so this is some of the ways that we can just go, and people go, I don't want to do that. Well, then you're going to have an autoimmune disease. You know, this practitioner that was in my office yesterday for a consult, she said, oh, this woman came in, and she said she had made the appointment with her like 6 weeks before, and she'd come in and she was having some autoimmune symptoms. And the woman's like, well, you know, I've changed my diet to a paleo diet, and my symptoms are gone. And this nurse practitioner said, well, that's really great. She says, why are you here? She says, well, I don't want to do this anymore, and I was hoping you could tell me something else I could do to fix it. She said, well, you fixed your problem. Stick doing with what you're doing. You don't need to do anything. So this person had fixed her problem, but she wanted to come to the doctor to try to get a pill so that she didn't have to stay on the diet. That's like how it works. All diseases begin in the gut. It starts in the gut. If you get a bad gut, you have autoimmune. If you have autoimmune disease, you have a bad gut. End of sentence. You have to fix the gut. You got to get off the foods that are irritating the gut. You've got to get the inflammation down. You got to get the bad guys out of the gut, and you got to build the gut back up and repair it. Okay, detoxification is an important process in autoimmune diseases. A lot of autoimmune patients need a lot of detoxification. There's varying ways to do this. You've, again, got to get the household cleaners and all the toxins out of your environment. There's no sense in detoxing and still using toxic chemicals, cleaners and solutions in your house. It's just not worth going through the process of trying to detox. The liver is extremely burdened in autoimmune patients because of the toxic load that we've been talking about. And when your liver is causing a problem, you're going to have an accumulation of toxic load. If you have had a job and your environmental toxins have been very large and you've been exposed, your disease orientation is going to be greater. You're going to have multiple things. Cancers, autoimmune, you're going to have lots of things because the toxic load gets so high that the immune system and the liver can't function. And without those two things, you're really creating a lot of problems. Once you have been diagnosed with heavy metal toxicity, you have to go through a process to get rid of it because the immune system won't work correctly. And if you ask me, detoxification is the last process that I do in this autoimmune thing. I fix the gut first, I get the inflammation down, I get the patient on a clean diet. Because if you detox a patient that has leaky gut and is constipated and inflamed, you are going to cause their condition to get worse. People say, oh, I've gone on a grapefruit detox, or I've gone on this or whatever, or they've gone to the co-op and they got themselves a detox kit. Don't do that. Because what you're doing is you're pulling toxins back out into the system, and your liver and your gut can't deal with it, and they're going to end up back in the system. And they may end up in your nervous system and in your eyes and in tissue, instead of in the bone, where that's a problem, but it's not as big a problem as having it land in your lungs or your eyes or whatever, your brain. I mean, there are better places for toxins than others, and bone takes longer, but I'm telling you, it's like a vault. And it's like pulling toxins out when your system isn't ready is a bad idea. And they get more toxic because they bind on to a thing, they get gone through phase 1 and phase 2, and they actually become more toxic to your system. So you got to be careful about it. Remove the source of toxins, use the proper nutritional support to support the detoxification pathways is critical. And consumption of large amounts of water. Water, water. If you are constipated, do not do a detox. I had a naturopath that would detox every single one of his patients. Every single one, when they came in to see me, had been detoxed, and most of them got sicker than they were before they started. Because they were constipated, they weren't prepared, their bodies were not ready. When you have a heavy metal toxicity or you have a xenoestrogen, these things are what we call free radicals. They have a negative charge on them, okay? When you eat vegetables and fruits and minerals, they have a positive charge and they attach on to the free radical. And they take them to the liver for detoxification. If your liver's not working or your gut's not working, you can't bind the stuff up, then it becomes this free and willy process that happens. Well, what happens to that once you pull the toxin out? They use chelating agents to pull the toxins out, but then your system actually has to get rid of it. And if you're not going and having bowel movement and you're not drinking water and urinating and sweating, you're not detoxing. So you got to get the systems all working well before you do that. Saunas. Infrared saunas are my favorite thing because they're the least invasive process. You sweat it out as long as you have enough minerals and you stay hydrated. It is the best form of detoxing. So if you can afford an infrared sauna, I'd get one. The prevention, you're going to remove the triggers, which is the immune reactive foods we talked about. Environmental toxins, you're going to remove the drugs and medications if possible. You're going to remove the infection and change the good and bad bacteria in the gut. This is what happens. This is the system. You damage the mucosal immune system inside the gut. This is in your gut. It causes imbalance in the gut flora inside your GI tract. It causes the intestinal barrier dysfunction, meaning leaky gut. Okay? It causes system inflammation. And then you go on and you start having neuroinflammation. That's the brain fog and memory loss. Oh, that's not that big of a deal. I got brain fog. I don't, you can't remember your name on some days. And then you have neuroinvasion, okay, meaning the nervous system and how it's working in the brain and stuff starts getting to have a problem. And then you start getting neurodegeneration, which is Parkinson's and Alzheimer's. Parkinson's is an autoimmune disease from heavy metal toxicity, which is this process. Final thoughts, okay? Drink a lot of water. You need to take this as a holistic approach and move in towards, adding vitamins, checking the hormones out, control your stress, breathing meditation, exercise. My daughter went to her first yoga class last night and she giggled the whole time. She's 10. I said, we got some work to do. Eliminate sugar and get the refined foods out of your diet. Detox, you eat organic and eliminate all toxic substances and eat healthy whole foods. If you're not doing this and you're not supporting this process, you're going to have a problem. And I'm going to tell you, I'm going to go back to these kids that I'm seeing that are between 18 and 25. Their systems have been destroyed. They're watching too much TV, they're not exercising, they're eating toxic food, the chemicals are extreme, their livers are toxic, and they don't stand a chance. We're feeding them toxic chemicals, and their immune systems are dysregulated, and I'm going to tell you that the life expectancy of our children today will not outlive us anymore. That was the expectation, that we are trying to create an environment that our children outlive us and live healthy. Well, I'm going to tell you that's not going to happen because the toxic load their systems are under and their liver distress, it's unreal. I mean, they're doing autopsies of people that have been killed in car accidents and teenage kids, and they've got osteoporosis and disease in teenage years because we're not treating our bodies well. We're drinking soda, we're eating crap food, and we have to really start providing good, healthy environment for our children and for ourselves. Okay, I always put this slide in so that everybody can understand leaving here that you can be empowered. In fact, I am certain, this is Marlo Margan, she says, I am certain that there has never been a doctor anywhere at any time in any country at any period in history who has ever healed anything. Each person is a healer within. I don't heal anything. You're coming in to see me, I don't heal you. Your body heals you. I'm giving you the tools to help your body do its job. That's partly every day we sit down at the table to eat. We're making a decision about providing nutrients and health and high nutrient status food or toxic chemicals into our system. Every single time we sit down, every single time we go to the grocery store, every single time we get into a fight with our kid, we're creating an environment for our health. The healer is within us. We have to create health and wellness for our young generation, for ourselves. We're heading towards a very difficult time in healthcare if our children get sick in their 20s and 30s. We're not going to have a workforce. Our healthcare, you think our healthcare is a mess right now? Just wait another 20 years. This is our clinic. You guys are sitting here. We provide one-on-one care. We really try to work at trying to find the underlying causative factors in each disease disorder that people come in with. This is what you do if you want to come in. It's listed. We have a very specific process. We're not a, fix it tomorrow kind of thing. This is for the long haul. We're trying to be part of your healthcare team to really give you an ability to choose health versus disease. And so this is the process that we go through for functional medicine in our office. And then here's our contact information.